do. And so I'm going to bring up MichaelRosen with, he is a consultant with the Science Park here, and he's going to talk about, really, before I go into that, I'm going to go back to how we met with Michael last year. Last year during FDI201, we were talking about the development he was working in Skokie. And the Skokie Tech Park, I want Michael to talk about a little bit and how it started impacting Skokie. But, the big thing that Skokie has, the problem they have is they're out of room. And so much to a lot of the development that's happened there, the idea of getting more wet lab space that's open to the public to start these incubators and accelerator programs is just heavy demand. So Michael, I'm going to bring you up and I'll let you run through your slide deck. And I'll put you on a hot seat and we'll have some questions. Actually, Rob, you're going to bring the clicker? You didn't bring the clicker. Okay, that's all right. I can do it with my little mouse.
So, good morning, everyone. So, so you made reference to the Skokie Science Park, and I see the mayor of Skokie here with his team, so I just a brief mention of that. So, one of the challenges for Chicago as a cluster, bio-cluster in the United States. So if you look, there was 2018 a major study done to look at biotech clusters in the United States. There's probably 30 or more biotech clusters in the United States. Chicago ranks in the top 10. That's the good news. We are number 10. The areas we ranked really well in terms of cluster analysis. So you can imagine places like Boston and San Francisco were number 1 and number 2. San Diego like number 3. Places like Seattle, Research Triangle, also ranked extremely highly. The areas where Chicago ranked well was talent. So people that worked in bioscience industry. So we've got a great cadre of talent. We had great NIH funding, National Institutes of Health funding. We were fairly good on a number of other parameters. The 2 weak areas for Chicago that ranked us lower in the rankings was venture capital, amount of venture capital, and in the bioscience industry, and 2, availability of wet lab space. So imagine if you go to Cambridge, Boston, if you go to San Francisco, each of those places has more than 20 million square feet of wet lab space. Wet lab space is very expensive. Typical wet lab costs about 5 times to 8 times as much as an office building. So if you're building an office building, think this is an office building on steroids. Both of these places had more than 20 million square feet of wet lab space. Baltimore, Maryland, Washington, D.C. area has close to 9 million square feet of wet lab space, bioscience space, critical for running these types of companies. Madison, Wisconsin, believe it or not, has about 3 million square feet of wet lab space. What do you think is in all of Chicagoland? It doesn't get to 2 million, quite frankly. There are estimates by Jones Lang LaSalle that has done reports. They report 5 million, but that includes space that's not really available for leasing, like AbbVie's space, like Abbott Park, which is over here. None of that's available for leasing. Baxter's own space. None of that's available for leasing. So in reality, space that's available for leasing is in less than 2 million. So one area we just ranked really badly was availability of bioscience space. So the creation of this science park and the Skokie Science Park was critical. So the Skokie Science Park was the first new science park in years. You may remember it was the pharmaceutical company GD Searle that got acquired by a European company called Pharmacia that continued on the expansion of Searle. And then a giant called Pfizer came in and bought the whole kit and caboodle and kind of eliminated everything. The mayor of Skokie suffered in this process, and I know I've heard his stories of all the suffering. 1,300, actually more like 1,500 jobs went out the door kind of almost immediately at that site, plus another 500 at Old Orchard when Pfizer kind of eliminated everything. And the impact on downtown Skokie, I live in downtown Skokie, so I know what the impact was. It was devastating. With the development of the Illinois, so the mayor was adamant that that part or that campus not be turned into condominiums. And he wanted high-value scientific activities going on, and he basically brought in, identified a developer that created the Illinois Science and Technology Park today. And today, they've actually got now more than 25 companies there, life science companies, a very good relationship with Northwestern University, as well as more than 1,500 jobs. So more jobs that were there originally are actually in that science park. And it's, I think, been a catalyst again for downtown Skokie, of which there's all kinds of things happening in downtown Skokie. I don't want to rob Mayor Van Duzen's story here, but just as Mike brought up the issue. So that's the kind of catalytic activity a science park can generate. And that's the hope here, up here. None of these science parks happen unless there is a public-private partnership. It can't be done by one institution alone. It can't be done by a developer. It can't be done by a city or village. It can't be done by a county. It can't be done by a state. It's got to be the combination of all of these. So in the case of the Rosalind Franklin Science Park, there we go, thank you. Again, without the leadership of Mayor Rockingham and his team, without the leadership of Lake County Partners, without the leadership of the Illinois Department of Commerce and Economic Opportunity, and Rosalind Franklin, and obviously the developer, the University Financing Corporation, none of this would have happened. And quite frankly, if the secret sauce here is putting all that together, that public-private partnership. I look around this room today and I see a lot of the faces 3.5, 4 years ago when this was an idea. Before I even came to Ron Kaplan, I remember sitting down with the mayor and his team, with Ron Lance, with Frank, and then obviously later with Victor. And this was an idea before I even met Ron Kaplan. And then I met Ron Kaplan, and that's when everything kind of really took off, because it needs a champion. And these kinds of projects need champions. In Skokie, clearly, Mayor Van Dusen was that champion pushing it forward. Mayor Rockingham has been a champion for this project since day one, but within Rosalind Franklin, Ron Kaplan has been the catalytic agent for this change in this university. So, next slide, thank you. So first, you've heard some of this already from Ron. I'm going to go through it quickly, but what you should know is that there are 55,000 life science jobs in Illinois. 33,000 of those jobs are in Lake County. So more than 2/3 of the bioscience jobs in the state of Illinois are in Lake County. There are obviously some downstate, some others downtown in Chicago. I've only listed here some of the companies that are in here. There are more than 122 companies. And we're not even talking about, so our catchment area here is not just Lake County. Our catchment area is really, to me, anything between here and Milwaukee, because there's not much happening. There are companies between here and Milwaukee, but there's not much happening in terms of where they can go. There's no real incubator or science park in Milwaukee. You've got some great universities there, Medical College of Wisconsin, University of Wisconsin in Milwaukee, et cetera. But all the action in Wisconsin is in Madison. So between here, our catchment area is not just Lake County, but southern Wisconsin as well, which, as you know, is only 10 minutes away. Next slide, please. So Ron Kaplan talked about this. This is kind of a visual representation. In order for this change to happen here at this university, he made another step in innovation that was critical. He totally redesigned research at this university. It hadn't been done since the beginning of when they started research here. So the old research structure that he told you about he focused it on where both industry and academia is going today, disease-based centers. So he radically changed. This was a real innovation that physically only got implemented officially July 1 of last year, so it's still a new structure. He created 6 disease-based centers. So you can see 3 of them, 50% of the scientists were brain-related disorders, and you can see the 3 brain centers that he structured. Next slide, please. And then you can see the other 3 centers that, also will. Now, all of these centers are going to be in the new building, and that makes it really incredibly attractive for industry to be able to partner, because now industry can understand exactly what is the research going on in this university. It's very clear, these disease-based centers, number 1. Number 2, it makes it really much easier for philanthropy and alumni to understand what's going on in this university, because now they can see everybody understands diseases, because we all suffer from diseases in one way or another. Either ourselves individually or our families all have one of these types of diseases, unfortunately. So I think it's, makes philanthropy easy, it makes industry collaboration easy, and it makes it easy for alumni to understand what's going on here in terms of research activities. Next, please. Yes?
If I may, please.
Sure.
With the brain studying, are they doing anything with PTSD in the base?
So I'm going to let Ron Kaplan, who's right there, who has been, so we're going to talk about, the next slide actually here is about the interaction with the level, no, sorry, go back one.
See if I can do it from here.
Nope. You're on the right track. So this slide actually, it talks about that relationship, but perhaps, Ron, you want to talk about that a little bit.
Yes. We've got several areas of collaboration with the Federal Healthcare Center, our basic scientists, their clinicians. PTSD is one of those areas.
I'm really glad to hear that.
Yeah.
Thank you.
So one of the unique things here when we were sitting down with Ron to figure out not only what's in the university, but what's around the university, and the other thing that really makes this interesting as a cluster is the fact that this Lovell Federal Healthcare Center is right across the meadow, just immediately north of us. And so you've got 2 distinct populations. So this is the only amalgamation of basically a naval hospital, a Veterans Administration hospital, 2 different patient populations. The Naval Hospital has 35 to 40,000 new naval recruits every year that are all young people going through everything from flu to strains and sprains, et cetera, et cetera. Then you've got the VA hospitals population, which are people suffering from diabetes, cardiovascular disease, Alzheimer's, Parkinson's, et cetera, et cetera. So 2 distinct population groups that make it interesting. Together, they're running more than 50 clinical trials for industry. 50 clinical trials, of which some of those are for industry. And you can see they complement well the activities going on within Rosalind Franklin. So Rosalind Franklin has the discovery and what we call preclinical research. The naval base has what we call clinical research. And you can see where both parts are collaborating with industry, but you also see the areas of collaboration that are going on. And right kind of smack in the middle there are the points of intersection. So next slide, please. So that's incredible resource to have there. Now, the other thing that Ron Kaplan did about 3.5, 4 years ago was to set up technology transfer. The university previously hadn't done much in intellectual property, and Ron set up the technology transfer area. And as you can see, although there was a slow initial base of patenting, this is now kind of accelerating both nationally and internationally, and making it very important for collaborations with industry, because industry will not collaborate unless there's intellectual property. Next slide, please. So the other thing that was critical to attracting industry here is the university had a series of research cores. So what are research cores? Research cores are expensive equipment, scientific equipment or services that an individual company itself it would be very expensive for them to set this up and run it. And each of these equipment areas can cost $1 million to millions of dollars. So Rosalind Franklin has several of these research cores, and I won't go through all of these. But the main thing is that Ron has made these available to industry for contract research without any reach in towards intellectual property. So a company can come in, contract research, and not worry that they're going to have to sign up a deal on intellectual property as a result. So this is critical. Also, the whole concept of innovation has started with faculty. So a number of faculty have started up companies. And Ron has stimulated further that kind of innovation. So we see, and working with Smart Health Activator, which has been a group that has collectively gathered industry experts in regulatory, marketing, financing, manufacturing of all the bioscience industry to create mentoring teams. So we now get into the science park. Next slide, please. So the amazing thing is when I sat down with Mayor Rockingham before I have even met Ron Kaplan, and we talked about this idea, then I got introduced to Ron Kaplan, and to see that this idea went from an idea to a board-approved concept to financing, to finding the developer, and to financing, and now to construction and delivery in basically 3.5 years is amazing. This is kind of light speed. Universities typically do not move like this. I can tell you, I worked with Johns Hopkins, I worked with MIT, I worked with Northwestern. Universities move very slowly, but that's why you critically need a champion, and Ron Kaplan was that champion to move this whole process forward. As was the prior president, Dr. Michael Welch, was a big supporter of this activity. Now, in addition to to get the first building going, we actually had to cannibalize faculty parking, and they were not thrilled about that. So we had to build additional parking. So hopefully the benefits of the new building will surpass the lack of parking that they lost. But that was a challenge day one. We had to get the parking lot expanded before we could start the building. Next slide, please. So these are just some quick shots of the building in process. Now, I've got some good news and bad news. The bad news is you're not going to be able to go into the building today. I'd have to have hard hats and vests for every one of you, and it would take a while just to do that, and we're still in heavy construction in the inside. The good news is you're going to be able to see it from the outside and from different vantage points, and you'll be able to see the new incubator that we've got in the adjacent building that we are just getting going. So I apologize, you're not going to be able to go into the building. That's why we did the fly-through, so you could get a good perspective. But you can see different stages of the development of the building. As Ron said, the building is just under 100,000 square feet. The industry piece of this will be about 32,000 square feet. It will hold a second phase of the incubator we've just started, as well as additional industry space. We also hope that it will be a catalyst for what we call international soft landing, so attracting international companies to set up shop there. And as Ron said, there are plenty of spaces for what we call collision, where industry and academia will collide, forcibly collide, which is what we want. Next slide, please. So I'm not going to go into this in detail, but the purple color is, so on each floor, there is industry space and there's academic space. So you can see this is the third floor and the second floor, and you can see the purple is the industry space, and you can see the academic space, but you also see in orange the common spaces that are available for both. So next slide. Again, you've seen some of these slides. Next slide. This is kind of what the lobby, the new lobby will be, which we hope will be a great a site for collisions as well as the break areas. Again, another view of the lobby. Next slide. Now, the other thing that Ron set up was it was critical to begin starting about 1.5 years ago to do this outreach to industry. So in addition to myself, we hired on an industry expert, Steve Kummerly, who's down in Springfield today at the Illinois Innovation Day. He couldn't be here. But Steve was 25 years ex-Abbott, AbbVie, ran their venture capital group, started out as a bench scientist, and he is doing a lot of heavy lifting on the industry collaboration activity. And we're engaging support with a number of companies that are very supportive of what we're trying to do here. We've started a Science Park newsletter that's now well into its second year on a monthly basis. The collaboration with Smart Health has led into our Biopathways monthly series. We've now done, as of last Tuesday of this week, we've now done 21 of these Biopathways series. So each one features a keynote speaker, a leader in bioscience industry, as well as a startup company doing a pitch. So we've had 21 pitch companies. We've also set up here an external advisory board. So one of the challenges was Chicago has 6 medical schools. Rosalind Franklin was the least well-known because all the others are mostly, 4 of them are downtown. One is in the kind of western suburbs, Loyola, and this is the only one up here north. And it was the one probably least well-known. So we had to begin to do outreach. And part of this was through the newsletter, this Biopathways program, but the other part was to create this external advisory board. And members of the external advisory board include Blue Cross Blue Shield, include AbbVie, include Lake County Partners, include Baird Venture Capital, a number of venture capital groups, Horizon Pharma, et cetera. And the other part was we've started international outreach to various countries, Canada, Ireland, Brazil. I'm actually heading to Brazil tonight, and China. We've had Chinese venture capital here. These are just, I won't go through all, these are just some of our Biopathways programs, so you get a flavor of some of the speakers that we've had speaking at Biopathways. Next, please. You can see, again, another flavor. Mark Peterson is our speaker for May 14th. Mark is president of Intersect Illinois, which is the state's kind of marketing organization internationally to bring in companies, particularly we hope life science companies, into the state of Illinois. So we want to hear about what his programs are because it'll directly impact what we're doing here. Next, please. Now, the Helix 51 Incubator. So in talking with Ron Kaplan, we realized that we can't wait until the new building is ready. Even though it's close, September, we really can't wait to get this entrepreneurial activity going. So Ron made available an amount of space that was kind of some old dungy labs that the university has totally upgraded, and you're going to get a walkthrough. So it's not officially, our official opening is May next year, but we actually now have 2 companies in there, Inspirotech and BLR Bio. BLR Bio is a spin-out from Rosalind Franklin, focusing on pancreatic cancer and fibrotic diseases. And this incubator, you'll see, has not only early stage companies, conference room for shared conference room, all kinds of equipment, but it also has access to the Rosalind Franklin Research Corps and the Rosalind Franklin Fitness Center. Now, this is kind of the philosophy of bringing all these pieces together. The strategic partnerships with industry, partner location or co-location here, the creation of startups, the education piece with faculty and students, obviously, and we're looking to create in the future an innovation fund for the startups. And so all of this is part of what we call the university innovation piece. Now, economic development, I think, really critical because ultimately, as you know, the city of North Chicago is not a wealthy community, and Rosalind Franklin wants to be and hopefully is a good citizen of this community. So the first and foremost, we asked the city for help in expanding the enterprise zone. So the enterprise zone is for communities in Illinois that it's an Illinois designation for economically distressed communities to provide fiscal incentives for companies to locate here specifically. And with the support of Mayor Rockingham and the state of Illinois, we were able to expand the enterprise zone to include the science park, which we hope will be beneficial, obviously, to attracting companies here. The other component was we applied for this new market tax credits. What does the new market tax credit program do? Well, it creates infrastructure, number one, but it also creates job training, internships, and job creation, and company formation. So that's part of the program that we expect to be spending some of the money on. We then hired Cushman & Wakefield as our exclusive broker for the science park, and they have been out beating the pathways down. Next slide. So when we talk about this, the impact, obviously, in economic development will be on local jobs. We've already started that with the construction aspect. With the incubator and industry component, we expect to obviously continue that on kind of a more permanent basis. And then Ron is going to be expanding his research group. The idea, he will be attracting new faculty every year that will be taking up residence in the new building. One of the things you have to know is that every research university in Illinois, all the 6 medical schools, have all added new buildings in the last 10 years. You cannot retain faculty or attract new faculty if you do not have state-of-the-art facilities. And this facility was critical for that. So as Ron said, his hallucination/vision is, as you can see here, the Phase 1 building, a Phase 2 building, and then hopefully in the future a Phase 3 building on fronting Green Bay Road. That is the goal. That is the vision hallucination. So, any questions?
Well, actually, I'm going to come up and speak with you a little bit.
Great.
Grab the two
So,
chairs.
there's a folder out on the table there. Latest brochure just came out in the last couple of weeks on the science park. Please feel free to help yourself. Kind of tells you what we're doing.
Great. So when we scripted this before, I'll get to you and Teresa in a little bit, but I get to do, why don't we just stand,
Then
wanna
here,
grab
or
the chairs,
whatever
or?
you want. You've got a microphone.
We have a microphone and we have a camera here. So one of the things that I'm kind of trying to bring this back to the premise, this is about Foreign Direct Investment 201. And we're talking about why these tech parks are critical for attracting and retaining talent. Approximately, and Ron, you might be able to answer this, how many of the faculty here are foreign born? And how does this go into attracting key either students or faculty to this region?
So that's a great question. This is now a guesstimate. I would say in our basic sciences, probably 20% of our faculty are foreign born. But I want to give an anecdote. We're in the middle of 3 faculty recruitments right now. And one of our top candidates, we were still negotiating with him, and he said to me, you wouldn't stand a chance of landing me if you weren't building that new research park. So that right there crystallized the importance of this. You know, recruiting into 40-year-old spaces for talented people is just not easy.
Great. And then the follow-on, and I've been to a number of there's iBio, BioPathways. I always kind of mash them all together because of different things.
iBio is the State Biotechnology Association. BioPathways is our program.
Right, but, and through the different times, I mean, you brought in the Economic Development Office of Canada in for a while. So why don't you
Correct.
talk about a little bit of what that was like and really learning about where they were looking at this spaces to help them in their recruitment of back and forth. So it's your story.
Yes, so if you look at the major life science hubs in North America, Toronto probably is in the top 5. You would also add to that Montreal and Quebec City are important hubs, and you've also got in Vancouver an important life science hub. Canada is kind of, in many cases, first of all, not just our neighbor, but there's a lot of life science activity going on in Canada. And all of the companies that are in Canada realize that the greater market by far is the US market. The Canadian life science market is about 10% of the US market. So if you want to be a player, it's easier for them to come into the United States than to go into Europe or Asia et cetera. And so the logical part for this Canadian outreach is to attract these companies down here. And so that was why Canada was one of our first targets. Another target that we have is Ireland, and we expect to lead. We've been working with Enterprise Ireland, and we're organizing with them a trade mission to Ireland later this year. And Ireland, for tax reasons, has become the jumping point into Europe. And Horizon Pharma, for instance, right down the road, it's got its headquarters in Dublin. Abbott, AbbVie, both have significant operations in Ireland. And so there's a lot of life science talent there. So that's why we're going to certainly Ireland. And there are other key markets that are critical. We've had Chinese venture capital here that's been very interested in potentially investing into our companies. And so other key markets are going to be continuing part of that. We used that strategy in Skokie, and I think important, Skokie had several German companies land in Skokie, as well as a New Zealand-based company, as well as a major Japanese company. So that was part of the mix, and I think we're looking at different countries perhaps up here based on the science going on at Rosalind Franklin.
Right, and then some of the ways that SelectChicago is working with Michael is when we're talking with the trade consulates. We've been making warm introductions to Michael. We've been working with the trade commissioner for Spain, and I know he's looking to get up here. We've talked to their intern corps, and mainly there's a lot of Spanish companies in the biopharma space that want to relocate to the United States, really to get into the venture capital space.
That's a great point. So, the UK, Germany are kind of overpicked at this point by, they're attracted probably more to Cambridge, San Francisco, et cetera. So we're looking for other places. I was fortunate enough to be CEO of a biotech company in Madrid. And so I know a little of the landscape, I know a little bit of the language. And Spain is now in several cities in Spain, Barcelona, Madrid, Granada. There's heavy activities going on in the biotech sector. So it makes it an interesting place for biotechnology.
But the key to it is the smaller wet lab spaces. They're 1,000 square feet, 1,500 square feet, where these teams of 2 to 3 can come. And that's exactly what happened with Skokie a number of years ago.
Right.
And so,
yeah, the idea there is to create what we call a soft landing program. So foreign companies usually haven't figured out, they see this United States and they see this one vast place and they don't know where to land. So you've got to help them and make it easy for them, and they need kind of a concierge service. People taking them around to introduce them to the community, to customers, to real estate people, just because they're going to have to buy a house and set up shop, lawyers, accountants, things like that. That's why this concierge soft landing service is critical for international companies coming in.
great. So let's open it up to the floor. So I know, Teresa, you had a question.
I have a couple questions, if that's all right. Number one, can you, and maybe you touched on this a little bit, but the collaboration between the private industry and what is their input into this? I didn't see if there's like a dollar figure or if there's a consortium of collaborative efforts going on with the private sector.
So, so I want to differentiate private sector here from bioscience industry from other industries. So we had to, so here's a challenge every community has and every university has. There's usually a shortage of resources, financial and other. And so the challenge was the university needed new research facilities. The university didn't have the money to spend to create a new research facility. So we had to create this public-private partnership that was not just relying on the university's resources, but using private sector resources as well as help from the state and the city. Now, in the days of previous days, Illinois Department of Commerce and Economic Opportunity actually funded science park activity and incubators under when Quinn was governor. Unfortunately, during the Rauner period. They cut back on all of that. Hopefully, we'll see what happens with Pritzker, but Pritzker was critical for funding 1871 and Matter. So and knows the bioscience industry well, so hopefully he will be supportive of what I call infrastructure. What had to happen was so the university couldn't afford to do this, but the university could afford to do a 30-year lease. And so a very creative financing mechanism was done with the developer basically going out and raising the money, leasing the space as a master lease to the university. We creative financing at the end of 30 years turns over the facility to the university. And the university could afford to lease space, but could not afford to build a new science park.
And then just on a follow-up on that, a lot of, obviously what you're talking about is lab space and R&D and that kind of thing. Apart from the pharma piece of this, what do you see in terms of more of a manufacturing or a supply chain into the R&D and the spin-offs?
Great. So this site is not going to be the site of what I would call traditional pharma manufacturing. We don't see that at all happening. What we do see is maybe early stage manufacturing related to research. So that is, in the biotech world, that means potentially cell production for vaccines and things, or early stage biologics, the raw material for biologics that are critical for the research to move things forward. That's the kind of what I would call early stage critical manufacturing. It's not huge in size, but it's critical to move this forward. We do not see this as commercial manufacturing at all. This is not going to be a site for commercial manufacturing.
Will the spin-offs then be, I guess I'm trying to think about how do we influence job creation through the R&D efforts that you're producing, and then the spin-offs from those. Can there be additional, more impactful job creation?
Yep. So Battelle, the Battelle Institute, did a study on the pharmaceutical industry and saw that for every bioscience or life science job created, 4 indirect jobs, additional jobs are created, whether for services, restaurants, hotels, other services that are created. So every life science job created is incredibly productive. And a typical life science job, so the average income in Illinois today, I think, is $56,000 or under $60,000. A typical bioscience job is about $100,000. So it's substantially above that, and it will create 4 additional jobs, indirect jobs as a result.
The direct jobs is what I was thinking of.
So Ron Kaplan mentioned before that the first building, the expectation will create both direct and indirect about 500 new jobs. That's just one building. So multiply that by 3, and you'll see that probably we will be well into the 1,500, 2,000 plus range. The first building will have an economic impact, as he mentioned, of $117 million. And if you add the 3 buildings together, it's upwards of about $500 million.
Great. So Ron, I know you wanted to clarify too.
Ron Lance with Lake County Partners. Every new manufacturing opportunity that comes out of the research park here is what we want to capture anywhere else in Lake County.
Yeah.
And I'll put this in for the mayor a little bit, we can elaborate on it. There is lots of extra land in the city of North Chicago also that could be repurposed former industrial sites to manufacturing, advanced manufacturing, biopharma manufacturing properties.
My
here
question
also.
was more on business attraction.
Yeah, we want to, that's why we're here, that's why we're part of the original setup of all of this. Stay directly connected, so as soon as they're ready to go to that manufacturing stage, we move them directly in Lake County to their next
And then we
opportunity.
can look at the supply chain pieces into that, and then maybe as a region, look at how that develops, in the region.
Absolutely.
Great.
Great question.
Arlene?
Great presentation. And what sort of collaboration do you see with Matter, as you mentioned them, and how that comes funding from Pritzker, and in this wonderful project?
Excellent question. So as you know, Matter is the bioscience offshoot of 1871. Same people that founded 1871 created Matter. If you go down to Matter, so Matter has 25,000 square feet, has no lab space at all. It's all office space. So imagine if the initial focus of Matter was digital healthcare. But more and more, they're getting interest in both medical devices, diagnostics, drugs. So we have been in discussions with Matter. We've nothing formalized, but that any companies that potentially would need lab space might come up here. And we're in very early discussions about sharing of programming, because they've got a lot of great programs down there that could be relevant for us up here. And we don't want to reinvent the wheel.
Okay. Last question. Any other questions? All right. Well, Michael, thank you very much.
Thank you.